everyone. You guys were you just quieted down as I walked up here before I grabbed the microphone. Thank you all for being here. Thank you for talking about such an important cause with us today. I used to say, thank you for taking the time to have a difficult conversation with us, but I've changed that to an important conversation because this is something that we have to talk about in order to make change. My name is Sage Hancock. I'm the Executive Director of Generation All. Generation All is a newer nonprofit that we founded last year to look at minimizing the generational impact of sexual violence. We know that sexual violence tends to last for generations. It tends to perpetuate, and until somebody intervenes and chooses to break the cycle, we can often kind of be hidden in these cycles of secrecy, shame, and it can feel really overwhelming. And so we started this nonprofit because we know that when somebody throws a stone into a pond, it has a ripple effect. The same way, the same thing can be said about sexual violence. We know that there's a ripple effect that goes beyond the survivor, and families and communities are impacted. And so our mission and the projects that we choose to work on focus around the survivor, which we know is at the core. And we know that if survivors get the correct healing that they need, if they don't get that healing, their children are 3.6 times more likely to experience sexual abuse themselves as well. So we focus on the survivor. We focus on families. We know that pain can often happen in families, but we also know that healing can happen in families. And then we focus on communities. And that leads us to why we're here today. This is the first event and the first part of launching Healing Generations in Utah. Healing Generations, we actually decided to go broader than just talking about sexual abuse. We focus on sexual abuse as well as childhood trauma as an all-encompassing priority. Childhood trauma is something that looks like sexual abuse, physical abuse, emotional neglect. It looks like household challenges like incarceration of a family member. It looks like addiction. These things not only contribute to the mission that we hold at Generation All, very close and very dear, but we also know that in order to make true change, we have to look at root causes. And that's why we focus on childhood trauma as a whole. A lot of this started thanks to our conversations with the incredible Dr. Nadine Burke Harris, which I'm excited for you guys to hear from today, and kind of her expertise on looking at this from a systemic problem that can be fixed. This is something we're prioritizing kind of three things with Healing Generations in Utah. We want you guys to speak out. That's the first thing. This is why we're talking about this today, to empower you all to speak out in your communities. We also want to remove the stigma. Something that I've said a lot to a lot of people in this room is 20 years ago in the mental health space, we were not able to openly speak about going to therapy, openly speak about taking anti-anxiety medication, openly speak about mental health struggles on social media. And we've come a long way where we've been able to reduce the stigma by quite a bit and to kind of create these empowering conversations around mental health and know that it's something that exists a lot in our community. And so we want to do the same thing in talking about childhood trauma, in talking about sexual abuse, in talking about childhood struggles, rather than keeping it something that we keep quiet and try and, push past and be resilient. We want to open up those conversations to allow for healing earlier. The third thing that we want to do is act. So it will be the first thing that we can kind of get started on how we can act together, what we can do in regards to policy, in regards to education, in regards to community awareness. I've been in the sexual abuse prevention space for a while, and I think a lot of you guys may have spoken to people out in the lobby, and you've heard the stats that 1 in 7 kids are sexually abused. 1 in 3 women experience sexual violence. If you guys have your pamphlet in front of you, you can see how many people experience ACEs, even here in Utah. It's a really big problem that seems really overwhelming. But I want to relate it to, in 1965, almost half of all Americans smoked cigarettes. it was like 42.6% of all U.S. adults smoke cigarettes. And through policy change, through education, through awareness about, kind of the harms that it can cause, through big community efforts, through programs like DARE in schools, we were able to drop that number down significantly. So even though these numbers might seem a little bit overwhelming, we believe that we can really make an impact and actually start to heal these generations in Utah and start to help the children who are growing up right now live happier, longer, healthier lives. And so, with that being said, I'm going to introduce some of our incredible speakers. I don't have it memorized, I'm sorry. So, first we are going to hear from Alex Peterson. This is her bio that I get the opportunity to read. Alex Peterson began her career working for United States Congressman before serving as the National Director of Donor Relations and Personal Aid to Ann Romney during Mitt Romney's 2012 presidential campaign. After relocating to Utah in 2015, she led corporate relations at doTERRA International and volunteered as a researcher and data analyst for the Utah Women of Leadership Project. Most recently, Alex served as the Director of Strategic Development and Impact for the Policy Project, a nonprofit that drives movements to drive healthy, equitable policy, which was outside, by the way. You guys should stop by on your way out and talk with them. Alex is deeply passionate about early childhood education and preventing sexual exploitation. She earned her undergraduate degree from California State University, Long Beach, where she interned with CNN and Fox in LA, and holds a master's in education policy from Harvard University. Alex and her husband, Ben, live in Utah County with their 4 children and spirited Rhodesian Ridgeback puppy. I love a personal comment at the end. You guys feel connected to her. She hasn't even walked out. That's great. And then immediately following Alex, we're going to hear from the incredible Dr. Julie Hanks, who is a licensed psychotherapist, content creator, author of The Assertiveness Guide for Women, online influencer, at Julie Hanks, FYI, you want to drop a follow, owner of the Wasatch Family Therapy, and host of the Ask Dr. Julie Hanks podcast. With 30 years of clinical experience, Dr. Hanks is passionate about helping clients claim their power and create a life that they love. Now, let's introduce Alex to the stage. Give her a warm welcome.
Good morning. Hi, I'm so happy to be here. Like Sage said, I actually used to work here about 10 years ago. I worked for the current CEO, Kirk Jowers. And one of the things we did was build out community relations, and that included trying to open this space to the community, to nonprofits, and to chambers of commerce. And so it's so fun to be back. This is a picture of our team on Halloween, just in the lobby right over here. And it was actually the 3rd floor in a conference room where I took a phone call. I was usually a very diligent employee. Kirk will tell you that, but I had a personal call on November 16th, 2016, right here with a woman, a detective named Detective Goodell, and she recorded the call, and I recounted details of sexual abuse I experienced as a child from a babysitter who lived in our home growing up. And I was in my late 20s at the time. That process started a 5-year criminal trial that I was a part of. And I think I looked, decently healthy. I had a normal BMI. I was married. I had a kid. I was contributing in the community and in my family and at work. But I was in a lot of physical pain. I had an autoimmune disease that I was having a hard time treating and didn't have a great practitioner to help with that. I had just been diagnosed and treated for thyroid cancer. I was treated at the Huntsman Cancer Institute at the U. It was right over my voice box. Not coincidentally, I think, an organ that had been silenced for 20 years. And I was suffering from secondary infertility. I had 3 miscarriages in a row. I was getting infertility treatment across the street at the Utah Fertility Center. And I was struggling with depression and anxiety as well. And all of this was kind of under the surface, just walking by on the street. you might not know it, but my experience is not unique. Dr. Burke Harris will talk more about the correlation between adverse childhood experiences and terrible health outcomes. And you really don't need to look further than one survivor of adverse childhood experiences to know exactly what the research will say. This is a picture of my family growing up. My mom sewed all of our dresses. She got a lot right. So did my dad. There were 5 kids. We lived in a really beautiful, affluent area. And we took family photos every year. And my parents were respected members of the community. And one of the things that really confounds people when they hear about our experience is that my parents did know that we were being sexually abused. And they witnessed a lot of the abuse. And instead of, firing our babysitter or calling the police, they would just tell us things like, if you don't like it, you can run away. Or this is just how life is, and you need to get used to it. It was kind of explained like going to the dentist. Like, this is unpleasant, but this is just kind of how life is. And it might be hard to imagine a mother saying that to her daughter. But before she was my mother, she was a daughter as well. This is my mom as a little girl, and then as a young woman. She was one of 6 kids, and she said that she spent most of her time outside in the woods because she didn't want to be inside with her dad, who was verbally and physically abusive to her mom and to her and her siblings. This is her mom, my grandmother, Dixie. Dixie's dad left when she was little. She got pregnant in high school. She married an abusive alcoholic. And she was a member of a Catholic religion. At the time, she didn't believe she should use birth control, so 6 kids very, very quickly, some difficult health challenges. And she mixed barbiturates with alcohol to cope with some of the pain in her life and was institutionalized in a mental hospital a few times when my mom was really, really young, and received electroshock therapy to treat manic depression. This is my dad when he was little, and then on the left, this was his favorite puppy. He was an only child. His parents divorced when he was 3. He lived with his mom, who was also an alcoholic, and he said on multiple times he would come home and she would say, "I swallowed a bottle of pills and I'm not going to wake up in the morning." And he knew that meant he had to go get the neighbors to call the paramedics. They would come and pump her stomach in front of him. And this dog he loved, he tells the story of one day he woke up and his dog was gone, and there was a police officer at the foot of his bed. He said, your mom took your dog to a bar and lost the dog, and then she hit a kid on her way home. And it was her 3rd time hitting somebody, so she went to prison. My dad had a lot of anger toward his mom, as you can imagine, and my mom had she'd seen some models that weren't super healthy. And so their relationship was interesting. My dad coped by spending most of his time working. I didn't see him much when I was little. And then when I was 8, he decided to live in a different state, and he would come visit 4 days a month. And that's kind of how they made things work. I loved having siblings. We had a lot of solidarity together. And they were really mostly loving and kind to me, and they ran as fast and as hard as they could to get away from the pain of their own experiences in youth. But parents can really only give what they have. And some parents don't have much by way of nurturance or protection or guidance that they can share with their own children. The Miller family knows this as well as anybody. If you can't heal your own trauma, it's hard to protect additional trauma. Aside from the professional photos we took, life looked more like this. This was the man that abused me and my siblings. He said he was most comfortable without clothes on, so every picture we have, he's only partially dressed. And for the record, if you're a parent and you're not sure how to protect your kids, if your babysitter won't wear clothes, that might be a red flag to consider. But for my parents, it was totally not a red flag. It was totally normal. And when I see this picture, I just see, 5 vulnerable children who had vulnerable parents who had such a skewed sense of safety and judgment because they didn't have any intervention when they were children. When their brains were forming, they weren't able to have any help understanding what was appropriate and what wasn't. And so they just taught our children that something totally inappropriate was actually appropriate, and we didn't know any better either. I just wanted to say, I know many of you worked alongside of us at the policy project with SB 205, getting full funding for elementary child prevention education. And that really would have been a lifeline for us, because we were told, don't talk about this outside the home. If the police ask, you need to say this isn't happening. But at home, it was totally normal. And if anyone at school had asked, it would have been a lifeline for us. And the same would have been true at the pediatrician. We did have excellent pediatric care at Kaiser. And I remember our pediatrician, he noticed when I was about 6 that I had stopped growing. I was about 50 pounds, and I stayed at that weight month over month and year over year for multiple years. And he asked about diet, and he asked about sleep, but he never asked, is there an adult in your home using street drugs in front of you? Is there an adult in your home making you drink alcohol and then sexually abusing you? Is there an adult in a home that's hitting or slapping or pushing you or anyone else? And I just don't think he knew to ask those questions. He prescribed growth hormones and Ensure shakes, nutritional shakes that can still taste the gritty flavor of those. I had to drink twice a day, but none of that actually helped. I only started growing again when we moved, we relocated, and the abuse paused. Okay. Sorry. I was just gonna say, this is a picture of my kids. No, I did not sew their clothes. In case you were wondering, some patterns and habits I tried to leave behind, even though they weren't all bad. But we have an awesome pediatrician. Every year when you see her, she asks, do you wear a helmet? Do you wear a seatbelt? And then she does a screening on an iPad and verbally to ask if they've been sexually abused or about any other adverse outcomes in their lives or any adverse experiences. And I know that would have been a lifeline for me and my siblings. And I think if every child can have the chance to have an ACE screening and be asked at school about abuse prevention, it can really shift an entire generation, and we can reduce the lifetime impact of adverse childhood experiences and trauma that comes out of that. We just didn't know better when I was a kid in the 80s and 90s, or when my mom was a kid in the 60s and 70s, when Valerie was a kid, or when my grandma was a kid in the 40s and 50s, but now we know better, so we have to do better. And our next two speakers are going to show us the way.
That was an amazing story. Like, my heart is beating hearing the emotions of hearing someone's personal story are so strong. So Alex, thank you for sharing that. They told me to stand on the right side because that's where the light is, but the computer's on the left side. So I'm going to hold my notes, and hopefully that'll work. I am Dr. Julie Hanks. I have been a therapist in Utah, specifically for 30 years. I started out working with children and doing play therapy, and then I realized that if the parents were doing well, and if the moms in particularly healed themselves, that was the best gift that I could give my community, is by helping moms and women heal. So that's been my passion. And I need to go get the clicker. You can't see me here, right? This is better, right? Okay. And I need to stand. I actually do have a presentation. It's not a comedy comedy strip. We'll figure this out together. Okay. I think we're ready to go. All right. Let's see. Oh, it works from here. Okay. So, yay, so happy. Okay, so this is me. Therapists do a couple of other things. I own Wasatch Family Therapy Clinics in Utah, and we are a trauma-informed clinic, and we deal with a lot of childhood trauma. We see kids through adults. But I want everyone to stand who has experienced childhood trauma or who knows someone who has experienced childhood trauma. I want you to look around. From what I can see, it's 100% of the audience. 100% of you have experienced childhood abuse or know someone who has. Is this a problem in Utah? Yes, this is a problem in Utah. Thank you. You can be seated. So childhood trauma is not rare. It happens here in our communities. So understanding trauma. What is trauma? It is not just an event. It is the experience of what happens, and it's also the effect of what happens. So it's a deeply distressing experience or series of experiences that overwhelms our ability to cope, causes significant emotional, psychological, and physical impact, and is caused by events such as accidents, natural disasters, abuse, neglect, or any other situation that is perceived as harmful. Dr. Burke Harris is going to go into this in detail, but I just wanted to briefly mention adverse childhood experiences. And you may not be familiar with that term, but it's called ACEs. And there are 3 different categories: abuse, neglect, and then household dysfunction. And so a lot of my clients will say, well, I wasn't neglected, I wasn't abused, but they did have an incarcerated relative or mental illness in the family, or violence, or substance use, or divorce. So those are all considered adverse childhood experiences that impact your health and mental health throughout life. This is a comedy act. There it goes. I guess I have to go halfway there. Okay, this is a problem. 1 in 7 children experience trauma. 1 in 7. 10,000 confirmed cases of abuse and neglect annually in Utah. Utah ranks above, I want you to listen to this, above the national average for child sexual abuse. That is unacceptable. That is unacceptable. And we'll talk about what we can do about that in a little bit, but less than 12% of child sexual abuse is reported. So most of this goes unreported. And then I frequently hear, well, people make up abuse. They kind of make it up. 1 to 4% of all reported cases are not true. So that's like hardly any. So if someone says, oh, you're making it up, or you think a child is making it up, it's really important to believe the victim, because that is very rare that someone makes up abuse. Why is abuse higher in Utah, specifically sexual abuse? We have a culture of denial. This doesn't happen in our communities. We are family focused, and we are, right? There are so many great things about living in Utah. But there is a denial that this happens, that abuse happens. There is a cultural emphasis on appearance. We're also the plastic surgery capital. No, we have more plastic surgeons per capita. I think we're #1 state for that. So there is an emphasis on appearance. And to say that something is going on in your home or family, some kind of abuse, or in your community, or in your church or neighborhood, that doesn't look good, right? We don't want to talk about that. That's uncomfortable. So we have to break through the denial and the cultural emphasis on appearance and deal with what actually is going on in communities and families. We have a high trust in authority, and we have close-knit communities. And there are so many great things about that. Lots of community engagement. I think we're also highest on volunteering, one of the highest states for volunteering in the community. So that's great, but high trust in authority and close-knit communities can breed secrecy, right? I respect this person who's abusing me, so I don't want to say anything. Or this person's my church leader, or my uncle, or my aunt, or my sibling. So that contributes to a high level of abuse as well. And then we have limited discussions on sex and sexuality in our state. We don't have comprehensive sex education. And a lot of families do not talk about sexuality because there is a cultural norm that sex is for committed married relationships. And so there is a lack of education about sexuality and what actually is happening if someone is sexually abused. So I'm going to call this client Sarah, but she came from a seemingly perfect Utah family, 5 kids. She was abused by a trusted friend, much like Alex's story. She had long-term struggles with anxiety, depression, and relationship problems, sexual problems in her marriage. And when she came to me, and one of the greatest honors of my life is being a therapist and witnessing the healing of individuals, couples, and families. And through therapy, through longer term therapy, because this is not like a couple sessions when you're dealing with intense abuse, she was able to become less depressed, to become less anxious, to feel more comfortable in her skin, to heal her relationship with her partner. So I have had a front row seat to the healing that can happen when people get treatment, evidence-based, trauma-informed treatment. So if you have experienced any kind of childhood trauma, please seek professional help. That's why we're here. That's why we went to grad school. Seek therapy. I love the mission of Generation All. One of them is to reduce stigma. That's one of my missions too. It's like, look, I have a therapist. I love my therapist. Therapists need therapists. I've gone on and off since I was 14. So get a good therapist, especially if you've had childhood trauma. All right. The long-term impacts of childhood trauma. And Dr. Burke Harris is going to talk about chronic illnesses that can happen. But there's also life instability, difficulty maintaining relationships, difficulty with employment or feeling good about yourself. And then mental health problems, right? Anxiety and hypervigilance, so you're always in the fight or flight. Hopelessness or depression, suicidality, PTSD, post-traumatic stress disorder. These are all associated with childhood trauma. Attachment and relationship struggles. Dissociation. So that's like feeling disconnected from yourself, like you're watching your life, and then you're not actually in your life or your body. And then self-esteem issues and feelings of shame. So these are all common mental health struggles that come along with childhood trauma. There we go. Okay. Is it seeming like it's getting, I have to get closer and closer every slide? Maybe I'm supposed to stand over there. Prevention and treatment. So trauma is preventable. If we educate ourselves and our communities and we provide resources for families, we can prevent some of the childhood trauma. Early intervention is so important. So important. In my therapy practice, I've often heard people recount abuse in their families or communities. But then there's also the response of their family or loved ones that can either be healing or hurtful and be another trauma. So to have some kind of abuse happen and tell a trusted loved one and have them not support you and not believe you, that's another trauma. But to be believed and to be held and to be comforted and to have services that you need in order to heal, that can be helpful. So how we respond to our loved ones to disclose trauma or abuse, that makes a difference. All right. I want to talk about 4 things that we can do using the acronym of HEAL. Okay, heightened awareness is the H. So we can educate ourselves, our communities, parents, teachers, and healthcare providers about the signs of trauma and its long-term impact. So education is so key in this awareness. Normalizing conversations about childhood trauma, making it so it's less stigmatized. Also, by sharing Utah-specific stats, we can, and I know Generation All is doing this, we can say, look, there's a problem here. We can break through that denial. And the E is engage early. Implement early screening in schools, pediatrician offices, and in faith communities. We have a large, prominent faith community here where kids and teens are meeting with clergy regularly. What if clergy screened for child abuse and said, hey, is anything going on in your home or in your community? What if parents were asking instead of just assuming it's not happening? We can train adults who work with children, teachers, clergy, coaches to recognize the red flags and know how to respond. And provide access to parenting resources and family support programs to intervene before abuse or neglect occurs. And the A is access treatment. We need to increase access to treatment. So expand trauma-informed mental health services, especially in rural and underserved Utah communities. Find affordable counseling services, including school-based therapy and crisis intervention teams. Offer evidence-based treatments like TFCBT, which is trauma-focused cognitive behavioral therapy, or EMDR. And there are multiple other trauma-informed modalities that you can receive from a licensed therapist that they work, right? They're evidence-based. There's research to back them up. So access treatment is the A. And the L is lead systemic change. Advocate for laws and policies that protect children, that don't protect abusers. Stronger mandatory reporting laws, more funding for DCFS to investigate abuse. Build cross-sector partnerships among schools, healthcare systems, religious organizations, and mental health agencies so we can identify and prevent abuse. Commit to ongoing evaluation and improvement of Utah's trauma prevention and treatment efforts. So holding the systems accountable for what are they doing to prevent and help treat childhood trauma. So my vision for trauma-informed Utah is that every child feels safe, heard, and supported in their families, in their schools, in their churches, in their communities. That we have stronger, healthier, more open-minded communities where we talk about difficult things. And so often when children or adults have health or mental health problems, We say, what's wrong with you? But we need to change that question to what happened to you? Behavioral problems, health and mental health problems are often results of something traumatic happening to a person. And that's a way that they cope with the trauma. And so instead of, what's wrong with you? What happened to you? Tell me about it. And then we listen. Here are some of my favorite resources. The ACEs website, where you can learn more about adverse childhood experiences. There's child abuse statistics through Utah State website. Child Protective Services, if you know of someone who is being neglected or abused, all adults are mandated reporters in Utah. So please report the abuse and neglect. Prevent Child Abuse, Utah.org. And then there's Safe and Healthy Families program through utah.edu, Utah Healthcare. And they have a great program for families healing from abuse. And then some of my favorite books are What Happened to You, The Body Keeps, I'm like, what book is that? I can't see it. The Body Keeps Score, and No Bad Parts. That is a fantastic book. It's based on internal family systems model that is used to treat trauma. And I have to say that is my number one most suggested self-help books. I can't recommend that enough. No Bad Parts. So What Happened to You, Body Keeps the Score, and No Bad Parts. If you're looking to learn more about how to heal yourself or someone you love from childhood trauma, please go to those resources or those books. And together, we can heal Utah. We can heal the adults, the teens, the children among us. Thank you so much for the chance to talk with you today. And it's such an honor to be here. I'm passionate about preventing and healing trauma in Utah. If I can be a resource to you, please reach out. These are ways that you can connect with me. I am here for you. My passion is particularly helping women heal from difficult situations. And so if I can be a resource to you, please reach out. Thank you again for letting me be here with you today.
We've had two incredible speakers so far, so thank you, Alex and Julie, for those informative remarks and also emotionally touching. And thank you all for taking your valuable time to be here. Today is about healing families. Today's about healing, as we know, in families and individuals, communities, and generations. It's about action and what we can do right now. And it's about honor. It's my honor, and my name is John Miller, by the way, as part of Generation All, to introduce someone who has helped the world understand that in order to heal, we must take action. And before I read Dr. Burke Harris's bio, I'd like to share why this moment is so deeply personal to me. Many of you know the story of Hometown Betrayal, the recently released book about my late wife, Valerie Clark Miller, who was sexually abused as a child by two men who lived in her community. Her trauma wasn't just something she carried silently. It became something our entire family carried. Her pain showed up in our relationships, our parenting, our mental and physical health, and it crossed generations. That's what trauma does when it's not recognized, not named and not addressed. Dr. Burke Harris's work has informed the mission and focus of Generation All and helped us to prioritize early detection and early intervention of childhood trauma to create healthier families and communities here in Utah. I'm excited for all of you to hear from a leader who has changed public health policy, who is seen as an expert regarding ACEs, and who puts her work into action and reminds us that trauma-informed care is not optional. It's the future of taking care of our children. Now let me formally introduce Nadine, Dr. Nadine Harris. She is an award-winning pediatrician physician, or pediatric physician, researcher, and public health leader who has spent her career on the front lines of some of the world's most pressing public health challenges. As California's first ever Surgeon General, she helped guide the state's COVID response to achieve the lowest mortality rate of any large state in the nation. Among the throes of the whole COVID pandemic, which you can imagine she was terribly busy, 24 hours a day probably, Dr. Burke Harris successfully launched a first-in-the-nationwide effort that trained primary care providers on how to screen for adverse childhood experiences and responsive trauma-informed care. Guess how many providers she trained? 45,000. So Dr. Julie Hanks mentioned, what a step forward. And this is what we believe we need here in the state of Utah. Dr. Burke Harris's career has been dedicated to serving vulnerable communities and combating the root causes of health disparities. After completing her Master's of Public Health at Harvard and a residency at Stanford, she founded a clinic in one of San Francisco's most underserved communities, Bayview Hunter Point. It was there that Dr. Burke Harris identified ACE as a major risk factor affecting the health for patients, young children, and applied research from CDC and Kaiser to develop a novel screening protocol. Her work has been profiled in best-selling books and award-winning films, as well as on BBC, NPR, Fox News, CNN, USA Today, it goes on, New York Times. Dr. Burke Harris's TED Talk. And by the way, that's how I learned about Dr. Burke Harris. I just serendipitously, I don't really believe that, but I heard her TED Talk. And I, along with 12 million others, have viewed that TED Talk. So her book, The Deepest Well, which is also a terrific book to read, and I'd recommend it to all of you, Healing the Long-Term Effects of Childhood Adversity, was called Indispensable by the New York Times. Now, beyond her professional achievements, Dr. Burke Harris is an avid gardener and finds joy engaging her 4 teenage sons in gardening adventures. I'd like to know a little more about that, maybe. But she describes her time in the garden as the ultimate stress buster. So it's my pleasure and joy in welcoming Dr. Nadine Burke Harris to the stage.
Thank you, John. And I want to thank all of you for being here, and especially thank our 2 previous presenters. That was really fantastic, and just gave this sense. I was looking around, and I could tell that all of you could feel it, this profound why, right? It's incredibly important why in terms of why we are all here. And so I'm going to touch a little bit on the what, the background behind adverse childhood experiences and how that leads to long-term health risks. And then the fun part, or at least my favorite part, is really talking about, and what do we do about it together? So this work really started for me, as you heard from John, when I started my pediatric practice in Bayview Hunters Point. And I was seeing kids who were referred to me by the community. And teachers or folks who were leading after-school programs, or sometimes faith leaders, would send me their kids, right? And they would say, please, Dr. Burke, it was before I got married, say, Dr. Burke, can you see Johnny? Johnny is, he can't sit still in class, he's hitting the kid next to him, the other day he even ran out of the classroom. Please, Dr. Burke, he's got ADHD, right, attention deficit hyperactivity disorder, can you put him on some Ritalin? And when I said, you know what, send him on down, I will take a look. And when I did what I was trained to do, when I did a thorough history and physical exam, what I found was that in the history part of the history and physical that doctors do, so many of the kids that I was caring for had experienced really significant adversity, right? And what I also noticed was that my kids who had the greatest challenges were also the ones who had the greatest histories of adversity. And a lot of the time, it was their behavior. But for a lot of the kids I was caring for, there were other factors as well. I'll never forget, I was taking care of a little girl with asthma. And I had given her 2 rounds of really powerful anti-inflammatory medications to keep her out of the hospital. And as I was sitting there, with her mom, going over the asthma triggers, and I said, what is it we could be missing? There are no pets, there's no cockroaches, we put the mattress covers and the pillow covers. And I'll never forget what this mom said to me. I said, are there any asthma triggers that we could be missing? And she said, Doctora, I noticed that my daughter's asthma tends to act up every time her dad punches a hole in the wall. And that, for me, as a researcher and a scientist, got me looking at the connection between children's experiences and environments and their health. And that's what led me to the ACE study. And as you heard from Julie, the term adverse childhood experiences, it comes from this huge study that was done by CDC and Kaiser Permanente. They asked 17,500 adults about these 10 categories of adverse childhood experiences, including physical, emotional, or sexual abuse, physical or emotional neglect, or growing up in a household where a parent or caregiver experienced mental illness, substance dependence, incarceration, where there was intimate partner violence, or parental separation or divorce. And what they did was they said, for every one of these, you get a point on your ACE score, and then they correlated these ACE scores with health outcomes. Well, what they found was absolutely striking. So the first thing that they found was that ACEs are incredibly common. 2/3 of the folks in their study had experienced at least one. So since the study was published in 1998, the CDC is now collecting ACE data and has data from all 50 states. And in fact, the woman who led a lot of that work, Dr. Melissa Merrick, is in the audience today, former leader of the CDC's ACE division. Right? And so, number one, ACEs are incredibly common. But the second thing, and when we look here in Utah, right, we see roughly 2/3 of adults in Utah have experienced at least one ACE. We see that 1 in 4 have experienced 3 or more ACEs, and that women are more likely to have experienced 3 or more ACEs than men here in Utah. So ACEs are incredibly common. But the second thing was that they found a dose-response relationship between adverse childhood experiences and both health risk behaviors, and adverse physical, mental, behavioral health, and relational health outcomes, right? So when we talk about dose-response relationship, what am I talking about? Well, pretty much this graph right here, right? So the more categories of ACEs a person has experienced, the greater the risk that they will have an adverse physical or mental health outcome. So initially, a lot of folks looked at this and they said, oh, okay, well, this makes sense. We know how this works. You have a rough childhood, you're actually more likely to drink and smoke and do the stuff that's going to affect your health, right? So this, this isn't science, this is behavior. And it turns out they're partially right, with an asterisk. I'm going to come back to that. So what we see is that the more ACEs a person has experienced, the greater their risk for high-risk drinking, early sexual initiation, teen pregnancy, as well as adverse behavioral health outcomes, increased risk of substance use and dependence, as well as mental health outcomes, right? Increased risk of mood disorders, anxiety disorders, impulse control disorders, right? That same dose-response relationship. This is a graph looking at the relationship between ACEs and homelessness. So we see, again, that dose-response relationship, the increased risk. But then here's the thing that kind of caught a bunch of people by surprise. That same dose-response relationship existed between ACEs and 9 out of 10 of the leading causes of death in the U.S., including heart disease, cancer, accidents, stroke, chronic respiratory disease, Alzheimer's, right? So one thing I'm going to say that I will confess right now is that I am a shameless science nerd, right? Not only do I love science, I love data. And so when you look at something like, for an individual with 4 more ACEs, their odds of heart disease is 2.1 as compared to someone with 0 ACEs. So they're about twice as likely to develop heart disease. For someone with an ACE score of 7 or more, that risk jumps up to about 3.5 times, right? So again, the greater the number of ACEs, the greater the risk. But here's what's fascinating, is that if you remove the effect of any health-damaging behavior, right? So you have ACEs, but you don't drink, you don't smoke, you're not sedentary, you don't engage in any high-risk behavior, that only takes away about 50% of the risk, right? So it's like, so on the one hand, that's good news, meaning you can remove about 50% of the risk by removing health-damaging behavior. But on the other piece, there's more that we have to look at here, right? Because how is it that you can experience ACEs and not engage in any high-risk behavior and still have increased risk for really serious health conditions? And it turns out the answer to that question lies in the biology of adversity. And it works a little something like this. So imagine you're walking in the forest and you see this guy, right? Did I scare you? Maybe just a little bit, not too much, right? What happens? So when we think about what happens in our brains and bodies, immediately our brain's fear response center, the amygdala, sounds the alarm, right? And it tells our brains and body to release stress hormones. So we release adrenaline and cortisol. Our hearts start to pound, our pupils dilate, our airways open up. We shunt blood to our big muscles for running and jumping, and away from that itty-bitty muscle that holds your bladder closed, so you may pee your pants, but there's no judgment. So, you are ready to either fight that bear or run from the bear. But if you were to think about it, fighting a bear wouldn't seem like a good idea, would it? No, look at him, he's big, he's got teeth, he's got claws. And that's why the fear center, the amygdala, actually sends projections. It actually sends neurons, nerve cells, that connect to this front part of the brain here, the prefrontal cortex, which is where this area responsible for impulse control and judgment and executive functioning. And you know what it does then, right? It turns it way down, right? Because the last thing you want, if you're in a forest and there's a bear, is some impulse control getting in the way of survival. And instead what it does, it turns up a part of the brain called the noradrenergic nucleus of the locus ceruleus, or as I like to call it, the part of the brain responsible for I don't know karate, but I do know karate, right? This is the within the brain stress response center, and it gets us amped up. Now, the less obvious thing that happens when you activate your stress response is that it also activates your immune response. Because if that bear gets its claws into you, you want your immune system to be primed to bring inflammation, to stabilize that wound so you can live long enough to either beat that bear or get away. This is brilliant. It was designed over millennia to save our lives from a mortal threat, right? Remember, the animals that didn't evolve this system, they didn't live to reproduce, okay? But the problem is what happens when that bear comes home every night. And this biological system is activated over and over and over and over again. And it goes from being adaptive or life-saving to maladaptive or health-damaging. And children are especially sensitive to the repeated activation of the biological stress response. So high doses of adversity in childhood actually affect the way that children's brains and bodies develop. They affect the structure and function of children's developing brains, their developing immune system, they're developing hormonal systems, and even the way our DNA is read and transcribed. One of the things that happens is that the biological stress response has difficulty turning itself off, right? So when you have this prolonged activation of the stress response system in a way that disrupts brain architecture and other organ systems and increases the risk for stress-related disease and cognitive impairment well into the adult years. So this biological process is what doctors now refer to as the toxic stress response. So remember before when I talked about the high-risk behavior, right? And I said I'm going to put a little asterisk, but I'm coming back. So this is a very dense and wordy slide that shows a little bit about the research that has demonstrated the ways in which our brains and bodies are affected by high doses of early adversity. And I want to just flag this last line here under neurologic. It says VTA and reward processing dysregulation. So it turns out that high doses of adversity in childhood affects a part of the brain called the VTA, the ventral tegmental area. It works together with the nucleus accumbens, and it is the pleasure and reward center of the brain. It is the part of the brain that is activated by cocaine, heroin, alcohol, tobacco, high sugar, high fat foods, all of the things that feel so fantastic, right? And the changes to this area of the brain can lead to increased risk of risky behaviors and increased vulnerability to addiction. And so when we say, oh yeah, those people, they may have had a rough childhood, didn't we all, and they just need to pull themselves up by their bootstraps, this does not acknowledge what the biology is telling us, right? That when we look and see that an individual with 4 more ACEs is 7 to 10 times as likely to experience substance dependence, right? We now are beginning to understand the underlying biological reasons. It's not just that they're a weak person and they need to just say no, right? But there are neurologic reasons for increased vulnerability. And one of the things that we understand now is that certainly, and as we've heard, and seen so powerfully demonstrated this morning that I'll tell you, as a pediatrician, I've seen ACEs handed down more reliably almost than any genetic disease I've ever seen. The intergenerational transmission is so powerful, and this is the reason, right, that Generation All was created and has brought us together this morning, is to really look at how do we target breaking this intergenerational cycle. Well, the good news is that ACEs are not destiny. And with early detection and evidence-based intervention, we can transform health outcomes. So you remember I was talking about doctors were just saying toxic stress response, right? Well, remember that the biological stress response is a normal and healthy part of human functioning. And there's the positive stress response, where the stress response gets activated, and then it turns itself off by itself, right? Normally. That's regular, what we call homeostasis, maintaining the body's biological balance. Now, it turns out with more severe or intense stressors, before you get to the toxic stress response, there's something called the tolerable stress response. And the difference between the tolerable stress response and the toxic stress response is so important that I put a little gold box around it. It says homeostasis recovers through the buffering effect of a caring adult or other interventions. That means that a child's system, right, gets really activated to the point where it can't recover by itself. Children are uniquely vulnerable that they require a caregiver or other adults to help them bring their biology back into balance, right? So we know that kids are vulnerable, but the good news is that we as a community of caring adults have the power to help children be able to heal from adversity. And one of the key findings in the California Surgeon General's report on adverse childhood experiences, toxic stress, and health that I and my team did is that toxic stress is a health condition that is amenable to treatment, right? One of the things I love about being a doctor is that this is what we do in science and medicine. We say, hey, we observe this pattern. Everybody drinks from a well. They all get sick. Let's take a look at what the heck is in that well, right? Because this is treatable. It turns out that toxic stress is treatable. And what the science tells us about how to address this and how to be most successful is, number one, intervene early, right? The National Academies of Sciences, Engineering, and Medicine, they did a whole report on this called Vibrant and Healthy Kids. One of the things that it says is that preconception through early life periods are the foundation of healthy development across the life course. Biologically, a number of critical systems are developing, right? Which is what makes them more vulnerable, but it also makes it a critical time for healing. And that humans have high plasticity during these life stages. So remember that slide I did before with all those that are like extremely dense with all the things that happen with early adversity? Well, the good news is there's also a ton of data about how we heal, right? So MRI studies have found that institutionalized children who were randomized into high-quality nurturant caregiving showed normalization of the developmental trajectory of the white matter structures of their brain. I'm going to say that again, right? Normalization of the developmental trajectory of the white matter structures of their brain with high-quality nurturant caregiving. So responsive caregiving also improves cortisol regulation. Things like time in nature reduces the activation of the fight or flight response and increases what we call the parasympathetic nervous system, the part of the nervous system that counteracts the fight or flight. We call it resting and digesting. But this is what happens when we spend time in nature. You guys got a lot of nature in Utah. I am jealous. Okay? Things like mindfulness, like meditation, is associated with decreased inflammation. Healthy sleep reduces infection risk, improves the function of the immune system, and regulates cortisol levels, right? So I want to spend as much time talking about the good news, right, as I did spend talking about what are the risks, because the science is showing us how we heal from toxic stress. And you take all of these fancy research studies. I've read, oh my goodness, there are probably over 20,000 research studies looking at interventions to help to regulate the toxic stress response, different aspects of it that I have read over time. And I have, for you all, boiled it down to this very simple intervention, right? These are evidence-based strategies for buffering the toxic stress response. Supportive relationships, quality sleep, balanced nutrition, physical activity, mindfulness practices, access to nature, mental health care. All of these things reduce stress hormones, reduce inflammation, and enhance neuroplasticity. And some of them even have impacts down to the level of the DNA. So when we're talking about the impact of these buffering interventions, we see, this is a research that was done in the UK. Here we have health-harming behaviors and lower mental well-being. Same dose-response relationship when we compare 0 ACEs to 4 more ACEs. Here's what happens when individuals get a whole set of buffering protective interventions. We see the lighter shaded bar is, we see a dramatic decline for folks with 4 more ACEs with their development of health-harming behaviors and lower mental well-being. And they also had this data for different health outcomes as well. As much of as a 55% reduction in health risk through buffering interventions. So, now that we do y'all believe me that there's stuff that we can do to help to regulate the toxic stress response and heal, right? So when we understand that, right, one of the key findings of the Surgeon General's report was that the key to curbing intergenerational transmission of ACEs and toxic stress, it requires a public health approach, utilizing a coordinated, multi-sector strategy for us to do prevention, early detection, and evidence-based intervention. And some places, when I came into office as California's first Surgeon General, there was people were having arguments about this. They were like, you know what, we need to focus on prevention. That's where our money should go, prevention. And some other folks are like, no, we need treatment. You prevention people trying to take our money. We need money for treatment. And it's like, I don't know about you guys, but I have too much to do every day, right? So the last I checked, we need all of it. We need prevention, we need early detection, and we need evidence-based intervention. And when we're talking about prevention, let me tell you, public health nerds, that same thing I just described, public health nerds call it primary, secondary, and tertiary prevention. Primary prevention targets healthy individuals to try to prevent harmful exposures from ever occurring. That's the best possible option. Secondary prevention involves identifying individuals who have experienced an exposure, like ACEs, and aims to prevent the development of symptoms, disease, or other negative outcomes. And tertiary prevention targets folks who have already developed an adverse outcome, and the goal is to lessen the severity or progression, right? And so, in the Surgeon General's report, one of the things I outlined is, all right, so what does it look like to do this on a community-wide scale? Number one, public awareness, right? We got to be shouting this from the rooftop. Everyone has to understand that ACEs can lead to toxic stress, which leads to long-term outcomes. Screening for ACEs in primary care for the purposes of early detection and early intervention. trauma-informed treatment approaches in primary care, specialty care, mental health, substance use and dependence treatment, right? Trauma-informed and trauma-sensitive educational spaces, multidisciplinary networks of care, culturally and linguistically appropriate supports. So these are some snapshots of a public education campaign that was launched by First 5 California. And in it, they had a couple different perspectives. It was parents talking about how their own childhood, that in the ways that made their parenting more difficult, right? And in all of them points parents to learn 4 things you can do to prevent toxic stress. Another one is of a doctor saying, hey, there's a health risk that could be impacting your kids. It's called toxic stress, and here's what it means. This campaign got launched in 2022, and since the launch of this campaign, they looked at a whole bunch of outcomes, but there's 3 I wanted to highlight for you, right? This is a statewide public education campaign. 93% of folks, when they polled people afterwards, intended to take actions to manage toxic stress in themselves and their kids. 89% believe that it is possible to help children heal from trauma. 88% believe that they can break the cycle of toxic stress in their children, right? This is public education. And this is that primary prevention focused on helping parents and caregivers understand their role in identifying and preventing ACEs and toxic stress. So real talk, right? One of the key pieces, and one of the things I really liked about these ads, is in one of them a parent says, hey, I had a rough childhood, and that kind of affects the way I parent. And so I had to get help for myself to prevent handing down toxic stress to my kids, right? Because that, I think that's the real powerful and resonant piece. Primary prevention. Then we launched an initiative called ACEs Aware, training our primary care providers on how to screen for adverse childhood experiences so we can do early and evidence-based intervention. So roughly you hear from different healthcare, CDC and others, of all the people who have a mental health disorder in the US, roughly about 1/3 of them are actually accessing care, right? And so one of the funny things that I hear all the time is like, really, you're going to have primary care providers screening for ACEs? Now, one of the things they teach us in public health school is that if you have a health condition, right, that 67% of the population has experienced, or a health risk that 67% of the population has experienced, you have to screen 100% of the population to identify that 67%, right? That's like public health 101. And so this is why the ACE screening doesn't happen at the mental health provider's office, right? Because this is by which time, not to say it doesn't happen, that's a place where mental health providers can help us unpack and respond in a really evidence-based way. But this is why it's so important to screen the entire community. And so in California, we have trained, now we're up to 46,000 providers trained on how to screen for ACEs. We reimburse our providers, okay? If we are telling doctors to do something and we don't pay them, it is because we don't care whether they do it or not. If we care whether they do it or not, we need to reimburse them. We need to treat it like any other health intervention. And so we reimburse our providers for screening. We train them on how to screen, and we also told them that the only way that they get to actually access that reimbursement is if they have taken the training, so they have to be trained. Right now, I am really proud to say that since January of 2020, 1/3 of California's children on Medicaid have been screened for ACEs. And what does that look like? The initiative that trained our providers is based, was housed at an academic medical center, University of California. And providers can get trained on how to screen for ACEs. And one of the things that the screening does is it gives providers a lot of tools about how to respond. Because the original ACE study was published in 1998. When I was a medical student or even a resident, I did not learn about it. So we have a lot of clinicians in practice who have not learned how to do this. And that is one of the big obstacles to making sure that our kids are getting screened. And so the ACE Aware Initiative provides a lot of resources, thousands of learning hours for how clinicians do this, how do they prepare their clinic, how do they get ready to do it, what do they do when they identify ACEs, all of the above. But you can see here that one of the things, the purpose of screening for ACEs is to identify who is at high risk for toxic stress. And I want to give you an example of what that looks like. So this is data from my actual clinical practice from when I was in Bayview Hunters Point, right? For my patients, remember all those kids who were being sent to me saying, he's got ADHD, can you put him on some Ritalin? When I started doing ACE screening in my clinical practice, when we looked at learning and behavior problems in kids based on ACE score, in my clinical practice, if they had 0 ACEs, only 3% of them had learning and behavioral challenges. If they had 1 to 3 ACEs, about 20%. So we're seeing that dose-response relationship. And if they had 4 more ACEs, more than half. Well, why does that matter? Because it turns out, once again, I'm gonna like stay with me here. This is like a super science nerd moment, but I love it so much because it's really important. This is a graph that shows the functioning of the prefrontal cortex. Remember the part of the brain that's responsible for executive functioning in response to stress hormones. What's the #1 treatment for ADHD in the United States of America? Ritalin. Stimulants, right? Ritalin, Concerta, Adderall. And the reason for that is because if you don't have enough stress hormones, you're distracted, disorganized, forgetful, and impulsive. So you're down in this corner of the graph, right? So as you add a stimulant, you start going up on the graph, and you become more focused, organized, and responsible. So that makes a ton of sense. That's the reason why Ritalin is the #1 treatment. But the problem is, what happens if you keep adding stress hormones, right? And you go to the other side of the curve. Your executive functioning is, again, quite poor. You're back to being distracted, disorganized, forgetful, and impulsive. But then you add a stimulant, and it doesn't work well, right? So then I would see patients that would come to me, they're on Ritalin, it didn't work. So then the provider had added another stimulant, and that didn't work. And then so they added an antipsychotic because this kid's got terrible behavior that's completely refractory to treatment, right? And it turns out, working with our consulting psychiatrists, one of the things that we did was we actually switched a lot of those kids, for our kids with high ACEs, from being on multiple stimulants to being on a medication. So it's not that we didn't use medication. We used a medication that helps regulate the stress response. A medication called guanfacine. It was originally developed as a blood pressure lowering medication. And it turned, I personally saw in my clinical practice, I cannot count the number of kids who went from failing to being on the honor roll, right? So it's not, so this is how, and this is what we're teaching as part of the ACEs Aware initiative. This is how understanding what someone's biology is allows us to improve clinical outcomes for kids and honestly for families, right? And so it's not just that we switch the medications, but we also recognize that we also have to do these evidence-based buffering interventions, reducing the dose of adversity and enhancing the factors that help to regulate the stress response. So another place where we see that, just another example, is that this is a graph from a fancy journal called Psychoneuroendocrinology. very, very fancy science journal. This is how I spend my quality time, is just reading scientific journals. But what it shows is that individuals with 4 more ACEs were 40% less likely to respond to antidepressants, the #1 treatment for depression, right? To SSRIs, sorry. Selective serotonin reuptake inhibitors like Prozac, right? 40% less likely to respond and 50% less likely to achieve remission, right? Why? Because one of the things that we see with the toxic stress response is that it doesn't just increase the risk for depression, it also makes that depression more difficult to treat. So it's really important. Many of our clinicians right now are doing the #1 treatment for depression. But unless they're also treating the toxic stress response, right, that treatment is less likely to be effective. One of the things that we did as part of the ACEs Aware initiative in California, and one of our pilot projects in LA at UCLA, was that we also, so this is data from kids who were showing depression and anxiety, scoring high on those scales. And this is actually without antidepressants with a mindfulness intervention. Mindfulness being one of the evidence-based interventions to regulate the stress response. And we see that when we treat the underlying biology, we can get improved outcomes. We can address ACEs and toxic stress by preventing ACEs and other stressors, but also by treating the toxic stress biology. And that is what leads to improved health. And the good news is that we don't have to do it alone. One of the things that we did in California was invest in growing what we called networks of care in communities. If we know that our experiences and our environment shape our biology, then the solutions are not just in the doctor's office, but also in the community. So we called a network of care is a group of interdisciplinary health, education, human service professionals, community members, organizations who are supporting families by providing access to the evidence-based buffered resources to prevent, treat, and heal the harmful consequences of toxic stress. And here's what's fascinating. One of the things that we did is we said, okay, we have our providers that we're training them on ACEs Aware, right? And then Medicaid is what we use to pay for healthcare for low-income folks and then also for a lot of kids. And we decided to align, in California, we aligned our systems with the science. So here's what's wild, right? In most places, doesn't matter how many ACEs you have, you don't even get access to care unless you have a mental health diagnosis, right? In fact, in most places in the United States, mental health providers can't even bill unless there is a diagnosis, right? Unless they're symptomatic. So I want you to take a second on that. So just imagine, right? If you take something like breast cancer, if you didn't get access to care until you were symptomatic, you got night sweats, you're losing weight, your lymph nodes are swollen, you got a big lump in your breast, then you get access to care. What would happen? Chances are we'd be detecting when the breast cancer is stage 4. The 5-year survival for stage 4 breast cancer is around 31-32% according to the American Cancer Society, right? So that would lead both patients and providers to believe that breast cancer is untreatable, right? Because everyone we see, boy, they got a terrible outcome. But wait a minute. When you detect breast cancer at stage 1, the 5-year survival is greater than 99%. When you wait until it's extremely far gone, that's when you see poorer outcomes. So, as California Surgeon General, one of the things I think I'm most proud of is that we changed the law to say kids can get access to wraparound services based on risk instead of based on harm. A child in California, a child in California who has 4 or more ACEs is eligible for wraparound services, and they don't need any other diagnosis. And this is what that looks like. Okay? In our pilot in LA, these were kids who were eligible to enhanced care management, which is wraparound services. For substance abuse, 28. Depression, 188. Suicidal ideation, I think that says 8. I'm not wearing my glasses. Lack of adequate housing, 148. Foster care status, 129. Autism, 219. ACE score 4 or more, 1,350. Right? In this one clinic. And only 71 of those kids with a high ACE score was eligible through another diagnosis. Right? Early detection and early intervention improves outcomes, but we need to align our systems to make early detection and early intervention even possible. So when it comes to a public health approach for preventing, screening, and treating ACEs and toxic stress, I want to emphasize to everyone, you don't need to boil the ocean. You just need to play your position. For our healthcare providers, they can screen. For our educators, they can provide the daily doses of safe and nurturing relationships that are demonstrated to be healing. For our mental health providers, they can do the evidence-based, trauma-informed interventions that are shown to improve outcomes. Right? We all have a role to play. If you are a parent, if you are a policymaker, you can advocate to align our systems in the ways that support early detection and early intervention. And I'll end by saying in California we did a cross-sector training for our educators showing how to do trauma-sensitive responses and interventions for kids in the educational space. We did training for our corrections and rehabilitation. We have public education that was for youth and by youth using youth voices, right, which was incredibly important. We can do this, y'all. We can do this. When it comes to public health challenges in the U.S., we're actually pretty decent at doing this. And some of y'all may look at this and say, well, all this looks very expensive, Dr. Burke Harris. I don't know how you all paid for this. You all love to spend money in California, but here in Utah. But here's the thing, guys. We're paying for it anyways. We're paying for it in special ed and incarceration and in lost productivity and all stuff. And actually, the CDC calculated what the cost of ACEs are in the U.S. Anyone have a guess? How much? Billions? Trillions? Okay. In Utah alone, the annual cost per year in direct healthcare costs, but most of this is lost productivity, right? Most of this are folks who, the cost of someone experiencing substance dependence or a severe mental health disorder instead of going to work and paying taxes, right? $100 billion annually in the state of Utah alone. Nationally, whoever said trillions was correct, 14.1 trillion. All right? When it comes to public health issues, if you look in the United States, we went from teen smoking, I know there's vaping now, but teen smoking, right, cigarettes, we went from 25% of teens smoking down to 3.6% between 1996 and 2016. That was one generation. When you look at lead poisoning, right, between 1976 and 1996, we saw this dramatic decline in lead poisoning across the United States. When it comes to HIV/AIDS, we went from a death rate, HIV had a 6-month mean mortality, right, in the early 80s. 50% of people were dead 6 months from diagnosis, to now, where the standard life expectancy is greater than 50 years from diagnosis. We have done this all in one generation, folks. And when we think about the mission of Generation All, where we want to be one generation from now, when it comes to the issue of ACEs and toxic stress, We can do it. The time is now. Thank you. Thank you all so much. I just want to leave you, there's a few resources that I have here. Building Resilience for Students Affected by ACE and Toxic Stress, the Roadmap for Resilience, the Surgeon General's Report, the Deepest Well, which is my book, Trauma-Informed Networks of Care, and the last one, don't forget, self-care is not selfish. You heard from John about my garden. It is my ultimate stress buster. So as we do this work, it's long work. We got to take care of ourselves. Thank you.
All right, we have had 3 incredible speakers right now, and we get to continue that. So we're going to do a quick panel with some of the most asked questions that these 3 have gotten, that we get at Generation All, to really speak directly to Utah. And so we're going to bring up Alex, Dr. Julie Hanks, and then bring back Dr. Nadine Burke Harris, because even though, you know, they've all spoken, you guys are not sick of hearing about them. So please welcome them on stage.
One of the first questions that we have is just a lot of times people are surprised by ACEs, by the impacts, and also by the intergenerational nature of them. How have you seen that play out in your own practices, just that transmission of the intergenerational stress?
In my practice, I'm always amazed by how often children are abused at the same age their parent was abused. And I don't know how that happens. I mean, yeah, I don't have time to go into it, but that I've seen that happen so many times, where it kind of repeats the pattern at the exact same age.
You know what's so interesting is I actually got shingles when I was 16,
Yeah.
all across my chest, and my mom said she had shingles when she was 16, when her mom was having a nervous breakdown.
Yeah.
Yeah, I would say the way that I have seen it shown up in my clinical practice, it's really funny because when you, as a pediatrician, the patient is really the family, right? And so one of the things that you see with dynamics, I see a lot of very well-meaning parents and caregivers who are doing the best that they can for their child in the way that they know how. And oftentimes when a parent learns a maladaptive coping mechanism, and particularly it comes out in moments of stress or trauma, and that is like the way that it gets handed down. And so a big part of it has to do with helping the parent understand how their own history of trauma may be impacting them, and then supporting them, giving them a set of tools to be able to do something different.
I love that. It just reminds me of that quote, until the unconscious becomes conscious, it will direct your life, and they'll call it fate. And we see that so often. Thank you. Okay, and then what are some ways that, for those of us who've experienced ACEs, or just those who want to take care of themselves, can regulate the stress response? And are there any resources that help parents manage that together with their children?
Yeah, I'll jump in on this one first. So, one of the things that was, one of the reasons I would say that I began asking the question about how are my patients' experiences impacting their stress response is because, no surprise, I myself have experienced not a small number of ACEs. And I remember I had two patients whose mom had an untreated mental health disorder and had driven into a building with the two kids in the back seat of the car. And I remember as I was doing their foster care intake physical, I wondered to myself, like my doctor brain wondered, I wonder what that must have been like. And then instantly I was hit with this like body memory of being in like a terrifying situation. And then of course, then I went back to my doctor brain and was like, what was that? That was a sympathetic stress response. Okay, so what's going on there? Cortisol.
You can all be so informed.
Right. And so this has been a fascinating experience because I began studying stress physiology and the regulation of the biological stress response to help my patients, but literally everything that I read and study, I use it for myself. And so things, when you ask that question, things like mindfulness, right? So a regular mindfulness practice, whether that's journaling or meditation, of which I do both, right? Regular exercise to really be able to metabolize those stress hormones. Mental health, you were talking about, you're a therapist, I'm just like, yes. Just all of these things I think are right on target. One of the things, I would say the single most important thing is to know what you're treating, right? So to be able to recognize like, oh yeah, because of what I've experienced or because of what happens to me, I may have a bit of a dysregulated stress response. And so that can look and feel like getting sick easily when I feel overwhelmed, or it can be having trouble controlling my impulses, or it can be being quick to anger. And to be able to see that and identify it, and then have your toolkit about what works for you, right? So for some people, it's their mindfulness practice is art, right? Or making music, or dance, and incorporating body movement can be really helpful as well. But it's really, the more we can start to recognize, how does this show up for me? Which is why I love journaling, because I'm like, here's what happened yesterday, and here's what fuck wild, right? And then also, again, the more we can really notice and pay attention to, and what's really helpful to us, right? Like noticing which people in your life are associated with soothing and calming your stress response, and which people in your life kind of activate your stress response. And it doesn't mean that the people who activate your stress response, that you cut them off, right? You may, if that's what's necessary and healthy for you, but it also may mean, like, for me, my mom is in her 80s, and she's still has mental health challenges. It's a lifelong issue. But what it means for me is, like, it's super clear that I need more support, because it's really important to me to have a mom, right? And to have a relationship with my mom. But my husband knows that, like, 2 squeezes means we gotta go. The thing that I will say is that it's super counterintuitive. It can be hard to recognize that we're more vulnerable. But when we do recognize that we're more vulnerable, that's when we get the opportunity to put in place the supports. I think it's that when we are ashamed of being vulnerable, so don't want to admit it, or when we deny we're vulnerable, then we kind of put ourselves in situations that that put us at greater risk, right? And that's where recognizing that vulnerability in a weird way is actually this incredible source of strength.
Amen. I love that. Just two quick things I'd like to add. The simple act of naming an emotion that's going on with you or helping your child do that actually helps bring the intensity of the emotion down. And so increasing your feelings vocabulary and helping teach your children how to name their inner experience can be a really helpful practical tool. And then one of my favorite strategies and favorite words is curiosity. To be constantly curious, like, oh wow, that really activated me. What happened? Oh, that reminded me of, and just being curious about your own emotional reactions and curious about, those of you who have children, your children's reaction, like what's happening, instead of jumping to teaching, lecturing, correcting, like, oh, what's happening, and helping them talk about it, I think is really helpful.
So good. Thank you both. Okay, last question. You both spoke about how the whole community has a role to play in addressing trauma. What are action items everyone here can take back to their community, to their church, or to their school, or to their family?
Well, I think being here today is something, right? Being educated, having more information. So way to go, and thank you. Reading books, Dr. Burke Harris's book, the books I recommended, educating yourself, and then speaking up when someone kind of minimizes the problem, like knowing your stats, being able to speak up and say, actually there is a problem, or my family's experienced this, and really leaning into those difficult, uncomfortable, awkward conversations about childhood trauma is a way that you can make a difference in your community.
So one of the things that I really recommend, and it's a learning from the ACEs Aware initiative, is that before clinics begin screening for ACEs, the number one thing that they do is figure out what they're going to do with a positive response, right? And that being prepared and having a plan or having a sense of understanding what to do with this is, I think, a critical piece that each one of us can do, whether this is something that's in our families, right? Whether we're doing it with our families, our kids, our community, our school environment, whatever it is, really having a plan. One of the things that's really challenging is that, let's say you have a school community that has no plan around how to respond to kids exhibiting symptoms of toxic stress or a disclosure of harm. Then, when the situation comes up, it's more likely that it's overwhelming to the folks who are responding, and so the natural response when something's overwhelming is, oh. And so one of the most important things that we can do in our communities, in our households, in our school environments, in our church environments, right, in whatever community that we're a part of, is be part of a process when we're saying, okay, how are we dealing with this? Number one, what is the work that we're doing to normalize some of these conversations among everyone and help everyone recognize that adversity happens, trauma happens, right? And that this is a safe place to have that conversation. Number two, if this does come up, what is our process for dealing with it? What are the supports that we can offer to an individual who is disclosing or a family who is struggling? So just having that plan makes it so much easier and makes it so that as an individual or as a community or as a system, you're not feeling overwhelmed in the moment. And then that actually creates the space for I think it just goes a huge way to reducing a lot of these challenges.
Amazing. Thank you both so much. Thank you all for being here, and thanks to Generation All for hosting.
It is very intimidating having to follow those three as an enemy. I feel like I should have just guided everybody to leave. These are three of the most incredible, well-educated individuals that I've had the opportunity to work with. If we could give them one more round of applause. And then a big thank you to our partners. If you look on the back of your agenda, we have some incredible partners. A lot of them have tables out there. Stop by, talk to them, ask questions. That is the group alongside what we're doing with Dr. Burke Harris, that we really want to implement this in Utah. We want to make change. We want to, in the same way that Dr. Burke Harris showed the prevalence of teen smoking going down, showed the prevalence of lead poisoning going down, how can we start bringing that into Utah? And you guys are a collection of people that are doers. And so we're excited to kind of move forward with you guys. On the back of both of your agenda, pamphlet, all that stuff, there's a QR code on how to get involved. That is a very specific form that we are utilizing to contact you if you want to be involved in this specific project with Generation All and with the work with Dr. Burke Harris. So feel free to fill that out if you want to continue to be involved. And on your way out, I felt a little conflicted about this because Dr. Burke Harris talked about exercise and nutrition and, kind of the good things. And we have free donuts for you all. Which I'm actually going to put in the self-care category. She spoke specifically about that too. So have a donut, self-care, and enjoy the rest of your day. And please take this information that you kind of learned today and speak, kind of work to reduce the stigma, act on it, get involved. Thank you for coming.